In this video, I will cover the proper order of operations for successfully treating musculoskeletal injuries and achieving long-lasting results. I cover the following in the video. What are the only structures we would directly treat as manual therapists? The proper steps to successfully treat an injury, what each step in the process includes, and why neuromuscular-based treatments are ineffective and dangerous. For those of you who don't know me, my name is Dr. Matt Maggio, and I'm a non-surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This results in a significant increase in flexibility, function, and long-lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, so following a proper order of operations is the key to successful injury resolution. Let's get right into it. So there are 7 structures. I call them the 7 big structures that cause a musculoskeletal injury. They're really the only 7 things that we're going to see as manual therapists, soft tissue providers, and really anyone that's coming in that's injured in pain. It's going to be a bone problem, a cartilage problem, a disc problem, a ligament problem, a nerve problem, a soft tissue problem, and a tendon problem. Now, for all you fascia people out there, fascia is considered under soft tissue. You know, a lot of people at me and they say, hey, what about the fascia? Yeah, it's in there under the soft tissue. But there's only 7 potential problems that we do see that can contribute to the pain and the dysfunction, and that's it. I made a really in-depth video about this in one of our training modules. So if you're watching this on YouTube, I will link it up top, and anywhere else you're watching it, it'll be down in the description box below if you really want to nerd out and go into like all the details, all the history presentations of all this stuff. It's all in there, so check it out. So the first step when addressing a problem, a musculoskeletal problem where someone comes into you, they're in pain, they don't move right, they're inflamed, all sorts of stuff, is we need to get range of motion restored. And this starts first with finding and fixing scar tissue and adhesion formation. You know, usually what happens is the adhesion first forms in the ligament, then it also goes to the muscle, and then eventually it gets stuck to the nerve, and then it has issues as well. The fascia is included in there as well. The thing about nerve entrapments, soft tissue dysfunctions, muscle issues, ligament issues are you can't stretch your way out of it, you can't cup your way out of it, you can't tape your way out of it, you can't corrective exercise your way out of it, you can't play tricks on the nervous system to get it to relax. You got to get in there with your hands and use your hands, because last time I checked, I'm a manual therapist. You watching this video are probably a manual therapist as well. Use your hands. Now, the key when you're treating this stuff and you're finding it is you got to find it first. So that starts with a very detailed evaluation, palpation, functional test, everything like that. You don't just go in and treat everything. You go in there, find the area where the most restriction is based off, symptoms, client presentations, everything like that. I teach a lot of that in some of my other videos more in depth. I won't go into all that right now. Then once we find that area where that adhesion is happening, or that scar tissue formation, or that nerve entrapment, we have to get proper depth. Then we have to back out a tiny bit. Then we have to get optimal tension into that. And then the client goes through a full range of motion as we hold that in and allow that tissue to slide. So a lot of people look at my videos and they go, oh yeah, that's just myofascial release, or that's active release technique, or that's pin and stretch. No, it's not. It's not. It's way better. And that's not me being a boisterous person. It's just way better. A lot of those techniques and those treatments are way too compressive. You get a lot of depth, a lot of tension, but the tissue doesn't slide. Hurts like hell for the client. So you think it's doing something, but it's really not. It's just playing a trick on the nervous system, and they temporarily feel better. It's very precise, very focused, slowing down and really letting that tissue slide. So you got to get that range of motion back by treating as much of the adhesion and the buildup around there before you ever do anything else. Now, once you do that, then you do need to balance strength. So when adhesion gets into the nerves, it gets into the muscles, the ligaments, the fascia, the first thing it does is it makes the area less flexible. But then it also makes it weaker. So as we're restoring the range of motion by breaking down the adhesion, we're getting more length into the tissue, but it's weak. So we need to build it up. So in the balance strength side of things, they have to be more of a corrective type of approach more isolated, maybe body weight or minimal weights. It's going to be slow and deliberate. We're not going to trying to get the client to be sore or work up a sweat. We're really just trying to reestablish some of those motor patterns, because a lot of times if there's been like an underlying nerve entrapment or issues in the muscles and the ligaments and the fascia, the body's kind of worked around there. So people will have different postural distortions. So a lot of people are like, oh, let's correct the posture. But it's like, why is the posture bad? Because these other things are happening. So we got to kind of get the body to get used to that. And that's by balancing the strength back in there. It's, single joint movements, nothing crazy. We're not trying to get them sore or sweat or anything like that. It's really just building and isolating that muscle up. Now, once we do get that back, they got good range of motion, the strength is balanced, they're in a better place. And then we do want to increase overall strength. That's going to be with like compound movements, multiple joint movements, more force and more weight. We're going to work the entire joint complex. Soreness is actually going to be good. And we do want them to be a little bit physically tired from that as well. So an example that I would give for this is like, say if I'm rehabbing a shoulder, I'm going to clean up all the adhesion in the rotator cuff, all the nerve entrapments, everything like that. Then we're going to get into like a side lying, very isolated, low weight thing. Then we're going to go into like an overhead press. And once that's good, we're going to go into like what's called an overhead carry, where they're going to lock out. It's going to involve all the joints in there, all the muscles, and really allow them to lock in. And that's where that strength comes in. So really important that you follow these order of operations. Last one is we need to retrain the neuromuscular system only if needed. And honestly, it's funny, when I got ready to make this video, I had some know-it-all who's still in like grad school basically tell me everything that I do is nonsense and there's no research there, and it's all just a problem with the central nervous system. You just need to rewire it and they're going to be fine. It's like, whatever, dude. I don't even know what I'm doing. So why am I even bother doing anything like this? You got it all figured out. I remember like what I was like at that age too. So I had a little bit of grace for them. Neuromuscular treatments, it isn't a treatment in any sense. And using these tools is actually dangerous to the client, in several aspects, because it doesn't actually make a physical change in the tissue. So I'm going to explain it on the next slide. So this guy here, his name is 𝘵𝘠𝘠𝘠𝘠, a very smart man. He is basically considered like the founder, the godfather of the neuromuscular based movements. And he basically said, respecting the approach of motor learning, any dysfunction in the periphery should be normalized first. So many people in the neuromuscular thing, they think it's like a problem with the wiring, like maybe the glutes aren't firing, maybe they have like upper cross syndrome, lower cross syndrome, and things just aren't working how they should. So we need to turn the brain back on and turn that pattern back on, because that's where all the pain is coming from. He's literally saying this, the guy who founded this, we have to get into the periphery first and normalize that first. What he's talking about is out further in the tissue and peripheral nerve entrapment. So for me, I start further out and then work our way up to the neck and everything like that. It isn't like a motor problem. They're like, the brain doesn't just decide one day not to fire the glutes or to inhibit the trap. It's doing it for a reason, because there's an underlying problem going on there. Maybe a problem to the bone, the cartilage, the disc, the ligament, a nerve entrapment. And you have to fix that first, because if you do all these neuromuscular based treatments, and the client like temporarily feels better, but you didn't actually fix anything, you're actually exposing them. So I always say this, say you have a client that is having trouble firing their glutes feel weak and inhibited. But the reason that they're weak and inhibited is because it's trying to slow down some of the wear and tear, maybe on the joints and the disc and the lumbar spine. So you do some neuromuscular based stuff, some tricks, some fancy stuff to get those glutes to start firing. And all of a sudden you think it feels better. Now that disc is actually exposed. And then maybe you go out and you're like, hey, today's the day I'm going to squat a house and feel good. But they don't have that pain telling them not to be on there. So they go in there, they load the disc, they blow the disc out. It's causing bigger problems down the road. So it isn't a wiring problem. It's that things are stuck throughout there. And you, being a manual therapist, can go in there and fix it, and actually fix it for good, instead of continuously doing these exercises, doing these tricks. There's people out there on the internet, I don't even know what the hell they're called. They're like rapid something, whatever. And they're like, basically they can fix chronic pain in like 2 treatments in like 10 minutes. I'm like, okay, so I'll get in like talks with them. I don't debate with idiots on the internet much anymore, but I'll say, this is amazing. I'm like, how much is your company worth? It must be worth like $1 trillion, because the chronic pain market in America alone is like $500 billion. So if you're fixing it in like 2 treatments with like this easy approach. Like, why isn't everyone else doing it? Because you're just playing a trick on people. You're not actually fixing anything. And then when you go in there, they say to you, they're like, well, where's your research on this? Where's the research on this? You know what? People like me and other colleagues of mine that have been doing this for a long time, we don't have time for research. We're in the real world. We're in practice, getting real results, doing real things. We don't need to hide behind research and say, oh, soft tissue work doesn't work. Adhesions aren't real. They are real. And people like me are doing it all the time. And we're seeing it in our practices. If that wasn't the case, we wouldn't be open. We wouldn't have a wait list. We wouldn't be dealing with all these other problems. So get out of your own head. Quit thinking so much that like you got to be a certain way or looking for the research and stuff like that. And just get in there, find where the area is restricted, use your damn hands and be a manual provider and do some great work. Little ranty there, but hey, all fired up. That's all I got in the video. Thank you for watching. Hey, if you liked the video, share any insights you might have gotten in the comment section below. I try my best to engage and talk to anyone, even if you tell me that what I do is complete sham and I should just quit even after 20 years of practice. Hey, I'll still have a conversation with you. I mean, you're not mad at me, you're mad at yourself, and that's okay. Maybe your mother just didn't love you. Number two, you could share with other providers that, you know, might help, that think like you and I do and want to be a manual therapist and not just some research junkie that's trying to, you know, justify their existence because their stuff isn't working. And lastly, go download my free training modules where we go through a whole system from start to beginning for a shoulder problem, evaluations, treatments, everything like that. The links to do that wherever you are consuming this video. I appreciate you watching, and I will catch you on the next one. Bye.